Great. So, hey everyone, thank you so much for logging on today. We're really excited to be here with the NHS and Bath University to talk to you guys about careers in pharmacy. So, we're going to go ahead and jump into the career section in the application in a few minutes here. But first, I'm just going to go over some housekeeping. So, the three ways that you can communicate today, we have the chat box, the Q&A box, and raising your hand. So, the chat box, if you have any input or any comments you'd like to say, go ahead and put them in the chat box. This hour is for you, and you have 4 to 5 great people on that can answer questions and communicate with you and network with you. So anything you want to say, feel free to put it in the chat box. And then if you have any questions, we also have the Q&A box. So please direct your questions there. And we will have a Q&A section at the end of the event. During that section, if you feel inclined to raise your hand, if you want to unmute yourself and speak out loud, feel free to do so. But we'll save that until the end during the Q&A section. So just to introduce myself, my name is Rosie. I'm the events manager at Pathway CTM. So I get to host tons of events just like this one with different brands all across the UK. So we're going to do a quick poll before jumping into it. I'm just going to launch it here. So the questions we have: what do you want to do when you leave school? University, apprenticeship, gap year, other, or maybe you don't know. How much do you already know about a career in pharmacy? You can rate it 1 to 5. 1, you know nothing. 5, you know everything. I don't know if anyone would know everything, but we'll see. And then, have you attended a Pathway CTM event before? Yes, no, or I don't know. The poll has been up for about 30 seconds, so I'll give you 30 more seconds to fill that out. Great, you have about 10 more seconds. Most of you filled it out. Great. I'm going to end it here and share the results. So what do you want to do when you leave school? 84% of you said university. I honestly haven't seen that high of a percentage in a while. So great to hear. University is a fantastic option, and we have someone here to speak about their university experience. So you're in the right place. How much do you already know about careers in pharmacy? Most of you know nothing to a moderate amount. So great, you're going to take away a ton of information from today. We have a lot to go through. And have you attended a Pathway CTM event before? We have about a 50-50 split. So great, I'll go ahead and put that link to sign up to our program one more time in the chat box. And last thing before jumping in to the pharmacy things, thank you all so much for logging in today. And if you stay until the end, you will receive a Pathway badge that you'll be able to put on your CV, on your LinkedIn, and share with employers as you're applying for jobs and university. So make sure you stay until the end to receive that Pathway badge. And now I'd like to go ahead and introduce Mark.
It's going to be me, actually, Rosie. Nick, but that's,
Nick, sorry.
that's all good. Thank you, Rosie. Good evening, everyone. Really great to see so many people on the call. My name is Nick Haddington. I am the regional head of pharmacy for an organisation called Health Education England, and we're the part of the NHS that deals with education and training for the healthcare workforce. So my job's really about looking after trainees in pharmacy, and that's both pharmacist trainees and pharmacy technician trainees. I cover the patch, which is the south of England, which covers the southwest, Thames Valley and Wessex. And I am a pharmacist by background. What we're going to do this evening is tell you a little bit about the different careers that are available to you within pharmacy. Next slide, please, Rosie. These are the main things we're going to cover. First of all, what jobs are there in pharmacy? What things could you do if you might be interested in working in pharmacy? Where are these jobs? And I don't mean, are they in Yorkshire? Are they in Devon? I mean, what type of work setting are they in? What training do you need for these jobs? What are the entry requirements? And also, what do you get paid? Because people are often really interested in what they're likely to get paid in different roles. Okay, next slide, please. So we're gonna cover this first. Where do pharmacy teams work and who's in the team? Well, pharmacy is all about using medicines effectively within healthcare. So people who work in pharmacy are healthcare professionals. There's a lot of patient contact. There's lots of regular interaction with patients and the public, regardless of the setting that you're working in and regardless of the role that you're in. But it is also a really interesting set of careers because it's about using science knowledge and using it in practice to help people get the most out of their healthcare and particularly the most out of their medicines. The pharmacy team work in really close conjunction with a range of other healthcare professionals, but they have a really distinct identity within the healthcare team. So we're going to try and answer these questions then. Where do pharmacy teams work and who is in the team? These pictures that are up on the screen give you a first taste of some of those areas. Let's go to the next slide, please. Okay, so here we've got a picture showing the different pharmacy work settings. Now in the middle, you've got that community pharmacy, that high street setting. So under that green bar, we've got these pictures of community pharmacy. And this is what most people think of probably when they think about pharmacy. So this is where people go to if they need to have advice about healthcare, if they need to get medicine supplied, if they need to have some general advice from a healthcare professional who's accessible. And within a pharmacy, you've got pharmacists, you've also got pharmacy technicians and dispensing assistants. And we'll talk a bit more about those different roles. The community pharmacy setting is becoming increasingly clinical, by which I mean it's less about the supply of medicines and more about the provision of healthcare to people and the public. So very often now people will be referred to a community pharmacy from NHS 111, from their general practice, from a variety of different settings, in order to have their conditions diagnosed and managed. We've also got to the left-hand side of this picture, this orange bar which shows hospital pharmacy. And the sizes of these bars at the top is designed to indicate how big that section of the workforce is. So the community pharmacy section of the workforce is probably about 60% of the workforce. We've then got hospital pharmacy, which is probably around 20 to 30% of the workforce. And again, pharmacists and pharmacy technicians have extensive roles within hospitals within the UK. And that involves being active on the wards, so walking around the clinical settings of the hospital, seeing patients, interacting with other healthcare professionals, and solving problems to do with medicines. There's a lot of patient interaction involved there. In the middle, you've got a picture of a dispensary, which is the section of the pharmacy and hospital that deals with the supply of medicines. And you can see these helter-skelters coming down. That's actually the output of dispensing robots. Pharmacy within a hospital setting particularly is a really good example of where we see advanced technologies within healthcare, including the use of robotics to manage the supply of medicines. And at the bottom, you can see some people who are gowned up in aseptic clothing. And those people are involved in the manufacture of highly complex medicines that need to be made in a setting that's either completely sterile in order to protect the product from getting contaminated with things like bacteria and environmental contaminants, or if the medicine being made is particularly dangerous to us, for example, if it's chemotherapy drugs or even radioactive, in which case it needs to be handled in a way that keeps the user safe. And over on the right-hand side of the screen, we've got some other areas. So we've got general practice. Increasingly, there are now pharmacists and pharmacy technicians who work in GP surgeries, seeing patients in clinics, being the medicines experts, doing those medicines reviews, and really playing a vital role in that aspect of healthcare. And that little black box we've got there, we've got the smaller areas, but still really important and really interesting career options, including in the pharmaceutical industry, in research, and also in teaching. And Lynn is someone who's on a call today who's directly involved in teaching. Okay, next slide, please.
Great. And Nick, I don't know if you saw, but in the chat, some of the students put what work setting they're the most interested in. And I'm curious, you guys, have any of you ever thought about general practice? Because I don't see anyone answering that. So did you maybe not know about it? Have you ever thought about it? Go ahead and put that in the chat box.
Yeah, that's really interesting, and it is quite a new area within pharmacy, but it's a real growth area, I would say, within the pharmacy profession. So that's really interesting.
Yeah.
We've got a question about radiotherapy in pharmacy. Should we come back to that later, Rosie?
You can answer it now.
Yeah. Okay. Good stuff. So radiotherapy and pharmacy. Um, they are both healthcare professions, but they are very different. So with radiographers, which are a type of allied health profession, they are involved in using radioisotopes either diagnostically or therapeutically. Pharmacy is about being medicines experts. So part of that might be the preparation of radioactive isotopes to use in some of those imaging techniques that are dealt with by the radiography departments. So they are quite different. They're quite different professions. Radiography is a very kind of defined discipline. There's two main areas. There's diagnostic and therapeutic radiography. Pharmacy is, I think, um, um, probably broader in terms of the sense that it deals with lots of different health conditions, but it's about being the medicines expert, the therapeutics expert. So hopefully that's answered the question a little bit.
Thanks, Matt. No.
So here we've got these three different roles on the screen, and we've got pharmacists, pharmacy technicians, and pharmacy assistants. So first of all, we'll talk about pharmacists. Pharmacists are healthcare professionals that are registered with an organisation called the General Pharmaceutical Council. So that's our regulator. And to be a pharmacist, you have to have done specific training and then pass registration exams to join the register of the GPHC, the General Pharmaceutical Council. We'll talk about the training you have to do in a bit. Pharmacists are clinical experts. That means they participate in direct patient care. There's lots of direct interaction with patients, face to face, helping to solve their problems, diagnose conditions, and use medicines and optimize medicines for patients. Pharmacists are unique in the healthcare team as they are the medicines experts. Pharmacists will typically lead the pharmacy team and have the highest level of pay. The next level, or the next group of staff within pharmacy, are the pharmacy technicians. They are also registered healthcare professionals with the GPHC, and we'd probably describe them as being technical experts within the pharmacy team. So slightly less clinical, but there are clinical aspects of the pharmacy technician roles, and they're experts in complex processes that support the work of the team overall. Pharmacists and pharmacy technicians really work very closely together in the provision of patient care. Pharmacy technicians can also have senior and leadership roles. They have probably what I describe as the mid-level of pay within the pharmacy team. Finally, we've got pharmacy assistants, a really important part of the workforce. They're not registered with the GPHC. We're not going to talk as much about pharmacy assistants today. This is an MVQ level 2 type training route, which is vocational, which is the route into this particular area of work. They're technical assistants, and again, they support the work of the pharmacy team overall. Generally, the lower level of pay within the pharmacy team. So next, we're going to talk a little bit in more detail about pharmacists and pharmacy technicians and the training routes into these two profession groups. Next slide, please. Okay, there's lots on this slide, so you might want to have another look at this later. But you can see for the two main roles, so the pharmacists and pharmacy technicians, we're going to look at the training, the entry requirements, the route in, and the level of salary that might be expected for these professions. So first of all, training. So pharmacists need to do a degree, and this is a Master of Pharmacy degree. It's a 4-year degree. And as I said, you have to become registered with the General Pharmaceutical Council. So all of the MPharm degrees are regulated and accredited by the GPHC. You then do, after you've graduated, a 5th year of training where you are on the job and you receive a salary. And at the end of that, you sit professional exams and then you become a registered pharmacist. In order to get into the MPharm degree, we've got the requirements here. Generally speaking, we're talking about 3 A levels at grades A to B. But it does vary from school to school, and some schools will accept a BTEC in applied science with or without an A level in chemistry. Some degrees also offer a route in, which is a kind of a year 0 or a foundation route for people who don't have exactly the right qualifications to get in at the kind of the normal year 1 introduction point. So the route in is a traditional application route for university via UCAS into year one, which is where most people go in, or year zero for foundation if you don't have quite the right qualifications. In terms of salary, in your training year, so in the 5th year of training, after you've done your degree, you would expect to receive a salary of about £25,000, which is a gender for change. It's kind of a standard NHS salary. When you're newly qualified, you'd expect to earn somewhere north of £30,000. And then as a senior pharmacist, probably somewhere between £45,000 and £50,000 is the salary that we're talking about. And as a very senior pharmacist, you might be thinking to be earning somewhere between £64,000 to £90,000 in those very senior roles. Pharmacy technicians is a different route in, and this is a really fantastic training route, which is a 2-year apprenticeship. So this is on-the-job training with a course which is paid for by the apprenticeship levy. So your employer essentially has levy money that's used to pay for the training, and it's generally at academic level 3. The entry requirements are typically 5 GCSEs at grade C above, but there are some alternative routes in for people who don't have quite the right qualifications. Sometimes there are kind of diagnostic or indicative exams that you can do to get into the apprenticeship courses. In order to become a pharmacy technician trainee, you don't go through UCAS, but you need to apply for an apprentice job. And those are typically advertised via NHS jobs. Some of them are advertised on the government apprenticeship website. In terms of what you get paid in year one, as an apprentice, you get paid about £17,000. In year two, about £18,000. And as a newly qualified pharmacy technician, probably around £22,000. In those more senior pharmacy technician roles, you might expect to command a salary of somewhere between 40 and late 40,000 per year.
Great, thanks, Nick. Can I just jump in here to kind of compare these two then? So most of you guys did say that you wanted to go to university, but as you can see here, so just to confirm, a pharmacy technician probably wouldn't go to university?
That's correct. Yeah. So this is a non-university route into a healthcare professional role. This is a on-the-job apprenticeship training route in 2-year apprenticeship. And yeah, so you're not a pharmacist, you're a pharmacy technician, but you're still a registered healthcare professional, and you get this on-the-job paid training in the routine. So it's really attractive to some people, and it's a fantastic career.
Yeah, and you guys, something to think about is you would leave that with no debt. So not only would you not leave with debt, but you would get paid while you're on the job. So really look into comparing these two roles when you're thinking about your future and kind of what is more worth it to you. If you want to be a pharmacist and go to university, that's great. If you maybe want to take a different route and look into being a pharmacy technician, that is also a great option.
Yeah, absolutely. There's a question in the chat, which is there a difference between a first year and a foundation year? Yes, you'd cover some more kind of science fundamentals in the first year to prepare you for the degree. It essentially gives you a lead in to the degree, to the first year of the degree. So that's a really good question.
Great, thank you.
At the end of this presentation, there are a number of links to provide you information to more careers things. But if you want to look at one place only, I'd go to this website, which is the careersinpharmacy.uk careers map. It's a really good interactive resource. It shows you this city with these different aspects of the pharmacy professions. If you're going to look at one thing after this, I'd suggest having a look at this website. It's really great, interactive, and an absolute ton of information.
Thanks so much. And Nick, just as we're moving on to the next section, would you mind putting this link in the chat box if you're able to?
Yeah, absolutely. I'll do that in just a moment.
Thanks so much. You guys, so now we're going to move on to the application process. So Lynn, are you on?
I am. Hi, Rosie.
Great. Hi.
Hi, everybody.
Thanks for being here.
Well, thanks for inviting me. So my name is Lynn Hanning. I'm also a pharmacist by background, but I now have an academic job. I work at the University of Bath, where I'm got a couple of titles. My role is Director of Practice-Based Learning, but what that really means is I'm involved in the design and the delivery of the pharmacy programme at Bath. And what I'm going to talk about is a very brief overview of what it feels like to study at university, to be a pharmacist, and you know that what I'm saying essentially applies whichever school of pharmacy you went to if you chose to study to be a pharmacist. And maybe also, I'm happy to answer. There's a few questions that have come up as we've gone through. I can see in the Q&A, and I can say a few words about some of those elements as we go through. So Rosie, if you can move us on. Thank you. So Nick's already covered the first slide that I've got, which is why study pharmacy. And I guess the point I really wanted to make is we are the third largest healthcare profession in the UK. And so an enormous opportunity, you know, big workforce, lots of roles, and Nick's alluded to some of those already. And particularly for me, if you can move on to the next slide, lot of opportunity for what you do. So Nick showed you already where, you know, the main sectors: community pharmacy, about 60%, hospital pharmacy. Someone's just asked me in the chat if we could mention a little bit more about general practice, and I could do that now. About if we go back 5 years or so, there weren't many jobs in general practice. It's absolutely new, and it's an emerging area where pharmacists are working in GP surgeries, doing a number of things. They are looking after patients with long-term conditions, looking after their medicines, looking after patients who might be on a lot of medicines, who have complex interactions between their medicines, or also sometimes looking after people with very minor illness. So, you know, a sore throat, a urinary tract infection, and actually they could see a pharmacist and have their treatment given to them directly without needing to see a GP. So we're seeing lots of roles, and what that means for us is we need to change the course. We need to be able to teach people to be able to do those sorts of things so that they can, so that they can are able to work in those roles. And about 30% of our students in last year's final year went on to work in general practice roles. So you're seeing that that's an emerging area for our graduates. And as Nick mentioned, other areas, industry and academia, like me. We're also seeing people pick and choose, have a little bit of both, a little bit of one or the other. So a little bit of work in hospital, a little bit of work in general practice. And that's becoming increasingly attractive. Can you move me on, please, Rosie? So, you know, let's think about what it feels like to learn and study at university. For us, it's really mixed. So it's a mixture. It's not just sitting in lecture theatres. It's workshops, it's practicals, it's private study, you know, getting used to being responsible for your own study, problem-based learning in teams, simulations where we kind of try and recreate practice. So we do lots of learning in the classroom. You'll hear in a minute, we do quite a lot of learning in practice. So in community pharmacies, in hospital, but also we do this bit in the middle, we call it simulation, where we set up and run a pharmacy in real time. We use simulated patients, we use actors, and that's about getting the confidence and competence right so that you're able to go out into practice and be able to look after patients. We do lots of placements, and I'll mention those in a minute. It's really important for us that we teach you underpinning knowledge. So we take you from where you left school, bring you through with very specialist experience, learning about medicines and how they're used in the body, how they're formulated and how they're designed, and then give you an opportunity to apply that knowledge. So it's quite a practical course. And we look after you closely. The same for any university, where we all have personal tutees. Everyone's allocated a tutor, and we follow you through the 4 years at university. And in fact, our graduate who's going to talk to you in a minute was one of my tutees from a couple of years ago. So next slide, please, Rosie. Other opportunities, we at Bath, we run a 4-year MPharm program, which I'll show you in a minute. And then our students leave us and go and do a year in practice. And then within the 4 years, you can do a research project towards the end of your degree. You can have an opportunity to do that overseas. And depending at a partner university, you can see one of our students, the picture there in San Francisco from a couple of years ago. But also, whilst you're at Bath and at any university, when you're choosing, you might want to think, what else would I get from the city or the university I've chosen? Is it a small city like Bath is? Is it a big place like Manchester? Does it have sports facilities or cultural activities or other leisure activities that you want to do? Do you want to continue to do something you're already very good at? Are you a good, I don't know, tennis player and you want to carry on? Or do you think, I've always wanted to try you know, I don't know, some form of dance, and actually there's an opportunity with a club. So most things you want to have a go at university, most universities would have some sort of society to do that. Okay, if you can move me on.
Yeah, and just so you know, I just asked in the chat if anyone's ever wanted to work abroad or do a year abroad, and most people have. So you guys, great opportunity here at Bath to get your degree and to have an opportunity to do that.
So perhaps if you can, I think Rosie, there might be some, if you could move on the next, apologies, I think, can we go back one? Or the words have not appeared? So just the last thing, I'm going to say something about the course, but just before we finish, one of the things we finish on this bit, one of the things we work hard on is what happens to our students after. So we do a lot of work on career support whilst we've got the students, and then a lot of opportunity to think about where you want to go afterwards. So those pictures are all actually some of our recent graduates learning in practice or learning in some of our facilities, and trying to think about where it is they want to go afterwards. Our students do very well, but that's partly because of how they apply themselves when they're at the university, but also the opportunities they take to do placements during the summer as well, and we encourage that. Can you move me on? So this is our course in a nutshell. It's very hard to show you 4 years worth of study on one page, but that's it. And you start in the bottom left-hand corner, having left school, and you leave in the top right-hand corner. Somebody asked a question in the chat earlier on, which I saw, which said, you've read that pharmacists will be able to prescribe in the future. And that's true. So pharmacists can prescribe now, but if they do it at the moment, they have to do a course at least 2 years after they've graduated or after they've registered. What's going to happen from 2025, 2026 is all our students will, by the end of their 5th year, so the year in practice, will be prescribers. And the question, I think, was, is that hard? And I think Nick's answered the question, actually. But yeah, it's no harder than it would be, because our students are well prepared for it at the time at which it happens. So a lot of our course over the preceding 4 years is to prepare you for all of those real world experiences.
Lynn, can I chip in there? I think it's a really good question, and I'm actually really impressed by Dominica that actually you picked up on that, because that's hot news. I'm a prescribing pharmacist. I actually don't work in clinical practice anymore, but I did my post-registration training so I have full prescribing rights, and these are quite interesting words, aren't they? Because if you prescribe, that means you're making the decision to start the medicine for a patient, whereas the traditional role of pharmacy is that we dispense or supply the medicines. But there's this really big shift to being a clinician, to doing the diagnosis and starting the medicines. So it's absolutely, in the gift of anyone who starts a pharmacy degree to kind of skill up to be able to do that. But it's a really exciting time.
Absolutely. And so what we're doing...
Can I just jump in there quickly?
Yeah.
Just with a question? So the role of a pharmacist is kind of changing. And I know you mentioned that is in 2025, 2026. So is that for people starting then, or people that will be graduating then?
It'll be from people who finish then. So our current first year who just started will be that year. They'll do their 4 years up till then they'll do their foundation year during that year, and they will be the first cohort of prescribing graduates, if you like. So my job is to try and change the course and develop it so that it meets their needs, so that they are ready to prescribe at the time at which they leave. So if you look at the program here, it does take you in a very natural journey from leaving school, usually with A levels. We currently require you to have chemistry and 2 others, including 1 science, and there's a list. And I guess the best diet to hit the ground running is biology, chemistry, and maths. And that's been a historical kind of view. We're seeing that change. I think people come with biology, chemistry, psychology, without the maths, and we give them introductory additional maths. If they have come without biology, we give introductory biology. So we're very used to kind of dealing with people who come with a mixture of qualifications. If you look at the course, it takes you on a very natural progression. So it's very fundamental at the start. But then it moves into these disease systems-based units. And if you can see, if you look, for example, at respiratory, we'd cover everything from, the physiology of the lung through to the how do you make inhalers, how do you design inhaler devices, how do the drugs work in the body that treat asthma, and then we take you out to see patients with those conditions. And we have placements that fit in the programme as well. Can you move me on a bit, Rosie, because I'm mindful of the time and I want to give the students a chance to say something.
Yeah, thank you.
We have an integrated model. So those topics I've just taught, we try and teach them all together so that you get to see all of those elements that perhaps at school you might have done in different silos, if you like, in different streams of learning. We try and bring them together because it's important that it's all as relevant as possible to the patient. And next slide, please. So I mentioned earlier on, it's really important to get you out into practice, and that's a large part of my job, which is about making sure that we get our students out at the right time to give them a chance to practice the skills. So there's pictures there of a lady in the green is one of my works half-time for me in the hospital, half-time for me and half-time in hospital, and she teaches the students in the hospital. There's a picture of Ade, who's a pharmacist in Bristol. And it's really important for us that we use lots of partnerships to get you out, whether that's Boots and Lloyd's, the pharmacies you might have heard of, smaller community pharmacies, general practice, and hospitals as well. And it allows you to decide what you like and what you don't like, so that when it comes to the point at which you need to make a career choice, you've got lots of information. Thanks, Rosie. So just a little bit for me to finish off on offers. The way it works for us and for many schools of pharmacy, but there's a bit of a difference, is that you send in your UCAS forms, and we make a decision to interview you based on your predicted results, your reference and your personal statement. Our normal offer is somewhere between 3 A's and A and 2 B's, and we usually we do interview all our candidates. Last year we interviewed everybody online, but previously we'd have an interview day. We invite you in and interview you face to face. We have a range of alternative qualifications, all of which are on our website, and there's a link at the back of the slides there for you. And you could look at other universities and see what information they have about their criteria, because they will be different. And there are currently 31, I think, correct me if I'm wrong, 31 schools of pharmacy across the UK. If you can just move on to the last slide for me, I think last 2 slides, but we do at the interview process want to see that you're able to demonstrate some values associated with working in the NHS. It's inherent upon all of us who run health courses to do that. And we're interested in your aptitude and skills. And that's about maybe non-academic attributes, but how well could you meet the needs of the NHS constitution? How well might you be able to demonstrate those? If you move me on, Rosie, I think the last slide's got a picture of what the NHS constitution looks like. I don't
We have a couple more, yeah.
Yeah, I don't test you on the knowledge, but I think the idea for us is that we're interested in whether you can give us some examples of where you might have used or demonstrated some of those skills in your in other activities to date. And some of those might have been, you might have gone on a work placement, but they don't necessarily need to be pharmacy examples. They can be examples from other team working, perhaps in the Duke of Edinburgh Award, or problem-based learning or team-based learning you might have done at school. Those are the values of the NHS constitution. And if you move me on the next slide, there are some examples of the sorts of questions we might ask, or other schools of pharmacy might ask, or other health courses. What skills and attributes do you think you need to be a pharmacist? And give an example of when you might have shown one of those. So that's quite a common question. Compassion and empathy are key values of the NHS. Give an example. Tell me about the time when you're a member of a team and something didn't go well. So, and then there's a question about respect and dignity. And they're just examples, but they're the sorts of things that you might expect to get a question about in a values-based recruitment interview, which is common for many healthcare professions.
Great. So it's important to do your research before applying.
Yeah, I think so. I think, we're not going to ask you tricky pharmacy questions. We're not there to catch you out. What we're there to do is to ensure you've thought about what you want to do, so you've got some experience. Even coming to this and be able to discuss something like an activity like this is great for us, because it shows that you've thought about it. If you're able to get some work experience, or even an afternoon shadowing a pharmacy and a pharmacist in a community pharmacy, That's great, and it's not essential for us, but it does allow us to see that you've thought about what you want to do. The last thing we want is you to turn up and after 6 weeks say, oh, I didn't realize it was this, that's not for me. So it's all about getting you as much experience as possible to help you make informed choices.
Great. And Lynn, just want to, before we move on, so say someone doesn't know anyone that's a pharmacist, anyone that works for the NHS, how might they go about finding an experience like that?
So I think, Nick can probably also answer that. There are a number of ways you can do it. That you can look at some of the links that we've sent you. There's links with the Royal Pharmaceutical Society, and they've got local committees who you can contact. But actually, the simplest way probably is to write a very brief, well-crafted letter and go into your local pharmacy and expect them to be busy and not be able to deal with you there and then, but to drop a note and say, look, I'm really interested in becoming a pharmacist. Is there an opportunity for me, to come back in one of my summer holidays and spend an hour or 2 hours shadowing what you do? And by and large, as long as you give them a chance to reply in their own time when they're not quite so busy, I'm sure many of them will be absolutely delighted to show you, what it is they do and offer you other opportunities. That's probably the easiest, simplest way. There are other work experience programs that are a bit more formal through hospital routes as well.
Great. Nick, do you have anything to add on to that?
No, I think that's really good advice from Lynn. Go in, get your face shown, show that you're interested, and very often people will be happy to accommodate. But this kind of event is really kind of a good way of doing that. As Lynn's pointed out, in the degree itself, there is a lot of on-the-job learning. There's the clinical placements embedded within the degree, but having something on your CV to demonstrate at the point of application that you're interested and you've made the effort to kind of go out there and learn more is really good.
Great, thanks so much.
Rosie, there's 2 questions about the interview process at Bath, and I just picked those up very quickly in the chat. So one is, what is the interview process? So normally for us, people submit submit your personal statement, and those are centrally reviewed at Bath. Then they come to us, and we would invite you to an applicant visit day. We tell you all about the course. And then we would do a short values-based recruitment interview. So some of those questions we've shown you, a short numeracy test, and it's very simple. And a very short personal interview where we ask you about, have you got any experience? Why have you applied? What are your motivations? And usually, and the second question is, what if that doesn't go well? And usually for us, by the time you've got through the personal statement bit and you've come to us and done the applicant visit day, usually the interview does go well. We usually make offers to most students who come. And if it doesn't go so well, it's normally a case of flagging it up to us that you might need some additional support when you come.
Great, thanks, Lynn.
So just there's a couple of links there for me, and I know that Nick's got other links that you can pick up. And I think rather than listen to me wobble on any more longer, I think there's an opportunity to talk to some of our students, which is some of our existing and ex-students, which I think everyone will enjoy.
Yeah, absolutely. So let's go ahead and move on to Rhiannon. Just before we do that, Lynn, if you wouldn't mind putting these links in the chat box if you could, just so that they're easily accessible for the students.
I will do. I'll do it now.
Great, thanks. Great. So Rhiannon, would you like to introduce yourself?
Yeah, of course. So, hi, my name's Rhiannon. I'm currently a foundation trainee pharmacist. So first of all, I'll just give you a quick overview of the sort of academic path that I've taken to where I am today. So I did my GCSEs in 2009, and then I started my A-levels in 2014. So I did 3 years of A-levels, and I did all 3 sciences and maths. I then applied to the University of Bath and I did the MPharm degree, so I was there for 4 years. I got into Bath with an offer for 3B, so I got a slightly lower offer, but I did note that in 2014 I started working as a pharmacy advisor, so I had a little bit of pharmacy experience, and actually pharmacy, I didn't really know a lot about pharmacy when I was younger. I definitely didn't have any sort of things like this when I was trying to choose my career. And I actually originally wanted to be a vet, but I'm actually from Cornwall, so it's quite a rural area, and I struggled to get the work experience for being a vet. And I started this job as a pharmacy advisor, and pharmacy was just kind of staring me right in the face, and I just fell in love with it. So I went on to do the 4 years at Bath, and I graduated in the summer with a first-class honours degree. and I'm now currently working as a trainee pharmacist. So I'm doing my training year at University Hospitals, Bristol and Western. So that's kind of a bit overview of where I am today. So if we just move on, and I'll give you a little bit more of an insight into what my day-to-day sort of life as a trainee pharmacist looks like. So I've based this off, I've just done a cardiac rotation for 2 weeks. I've kind of based it off that sort of my day-to-day in that. So I start roughly around about 8:45, 8:30. And in the mornings, what I'll normally do is I will head to the wards with the other pharmacists, and we'll do medicines reconciliations. And what that is we'll look at, basically do a drug history for any patients that come into hospital. So we make sure everything they were on before coming into hospital, it's all been given to them whilst in hospital. And also we will look at medication ordering. So we'll ask the nurses, doctors, is there anything that needs ordering urgently for patients? So that takes up most of the morning. And then I will head back to dispensary for about an hour before lunch. And in the dispensary, I'm currently doing my checking numbers. So traditionally in a lot of community pharmacy, a lot of it is sort of checking prescriptions, and we also do that in hospital pharmacies. So at the moment I'm practicing doing my checking numbers, so I have to check 500 items without any errors. So I'm currently doing that, which is good fun. And then I will head to lunch, and then after that I can go to the wards again, and it's more of a clinical focus this time. So what I'll do is I'll pick a patient and I can clinically review them. So I'll have a look through their notes, why they've come into hospital, and then I will look at all their medications, is it appropriate for them? You look at their blood tests, you just make sure everything that's been prescribed is appropriate and right, and then I'll talk that through with the pharmacist and just sort of relay my findings. And then also patient counselling is quite a big part of my role at the moment. If any patients have been newly started on any medications that require quite in-depth counselling, then that's also one of my tasks at the moment. And then normally I'll finish around about 5 or 5:15. So that's kind of what my day's like at the moment. We are supervised and we're shadowing pharmacists, so we're not fully fledged at the moment, but we do have a lot of opportunities to be able to apply our knowledge and then get it checked by a pharmacist. So that's sort of an overview of my day in the life as a trainee pharmacist. So if we just move on.
It sounds like,
yeah, sorry.
I was just going to say, so it sounds like as a trainee, although you are supervised, you are doing important work still.
Yeah, I think the whole point of the training year is to, by the end of it, they want you to be competent and confident in what you're doing. And the only way to do that is to actually get involved with everything that's being done. So, from day one, I've had a lot of patient interaction. So, you go on talking to patients with the medication reconciliation and the medication counselling. I was a bit nervous to start off with, but actually, the more you talk to patients, the more actually you enjoy doing it. They are just people at the end of the day. Sometimes you kind of can put to the side that, you're looking after them and they're there for your care, but actually they are people at the end of the day. So it is nice to be able to, you get more confident with the patient side of things, which is, yeah. So yeah.
That's great. Thanks.
Okay, that's okay. And then just to give you an overview of what the rest of my year might look like. So I've just put in there's lots of rotations I'll be doing. So I've already mentioned I've done my cardiac rotation. There'll be respiratory, surgery, oncology. So they're really preparing us for at the end of our year when we get sort of not thrown into deep end, but you're sort of a fully fledged pharmacist. So you know a little bit about every area. And then it does help you to be able to identify actually maybe where you want to work in the future. And then also I've just covered some of the HE training days. So I know Nick mentioned earlier that Health Education England sort of look after the education side of the training year. And these are just some of the local learning set days that they put on. So they're basically almost like university days again. So you'll get teaching for GI and surgery, cardiovascular stuff. So they really are, it's not just you leave university and then you're on your own to sort of do this year. You still have so much support. So I have a supervisor at the hospital. We also have an education and training lead. And then there's also a HEE leader that covers our area, the Southwest and Bristol area. So it is very well supported as well. So that's everything I've got to say. I have just added my email there, so if you've got any other questions or anything, then feel free to email me. But yeah.
Oh, thank you so much. And you guys take advantage of that, because that's not email someone directly. Any questions you have for Rhiannon, feel free to email her or right now, go ahead and put them in the Q&A box, and we'll get to as many of them as we can at the end. Rhiannon, I'm not sure to see your email actually in there, so if you maybe want to go ahead and re-put it in, just to make sure everyone can see it.
Yeah, I'll put it in the chat.
Great, and now we'll go ahead and introduce Charlotte.
Hi, so as I said, I'm Charlotte, and I have just gone into my 3rd year of pharmacy at the University of Bath. So I'm just going to touch a little bit on how I kind of got to where I am, what it's like being a student, and then looking into the future a little bit. So when I was in school, I did not have a clue about what I wanted to do at university, but I was always interested in maths and science. So I had chosen to study biology, chemistry, and maths at A level. And I kind of found that a lot of my teachers tried to push me towards the medicine route. And I think from speaking to other people, that's quite a common thing that happens. And then kind of by chance, I got a job at the weekend working in a local community pharmacy. And I kind of got introduced to what pharmacy was, like what the job of pharmacist consisted of. And it actually was very different from my prior knowledge and like what I perceived it to be before I started working there. So I was very lucky that the pharmacist I worked for went above and beyond to kind of help me, show me what it was like. And then when it came to applying, he kind of helped me. So I ended up applying for 5 universities in the UK. And as Lynn touched on, I went through the interview process and then picked where I wanted to go. And then I actually didn't get the grades that were what I was offered, but I still did manage to get into Bath. So yeah, in terms of being an actual student, I can obviously only talk about my experience at Bath, but it encompasses a really wide variety of teaching, which Lynn touched on quite a lot. It's a lot more than just sitting in lecture halls all day, every day. And as you go through the course over the 4 years, the amount of practical based like teaching that we have increases, which is really valuable. So just to kind of give a bit of an idea, in the past week or so alone, I've been doing lectures, I've been doing smaller group workshops. I spent half a day at a hospital in Swindon, where I got the chance to speak to patients and practice clinical skills, which was based upon learning that we'd been having in the classroom. I had to work in a small group to develop a scheme for a community pharmacy, and we had to present that to a group of peers. And then next week, I'm actually spending the full week at a hospital in Bath, which will help me gain experience of what hospital pharmacy is like. As Lynn also said, and I think some of the questions have kind of touched on changes that are going to be happening to the course over the next few years. So I believe it's going to become even more placement based. And then as mentioned, the opportunity to then become prescribers, which is obviously, I don't really know very much about, but I think that will be a really interesting change to the course. And then in terms of the future, I'm really not sure what I want to do yet. I'm lucky enough that in the summers, I have the opportunity to work in a community pharmacy and a hospital pharmacy. So that gives me really good opportunities and a wide variety of experience. And as also touched on, the emerging opportunities for the foundation year in multi-sector roles is so beneficial and is going to open up a number of different paths for people who still aren't quite sure, which will probably be me this time next year. So yeah, it is a really valuable course, and I think it's really interesting for anyone that is thinking about it. So, yeah.
Great, perfect. Thank you so much, Charlotte. And you guys, if you have any questions for her, feel free to go ahead and put them in the Q&A box. I see that many of our questions have been answered, typed out, but we're going to go ahead and move on to the Q&A section. And there are a couple here that I just would like to touch on out loud. Thank you guys for typing them out, but I just want to make sure that everyone can kind of hear them so that everyone knows what the answers are. So I believe this would be best for either Nick or Lynn, but do you need any specific grades for pharmacists or just A levels?
So the entry requirements, I think Lynn's probably slightly better to answer this than I am, but essentially you're looking at your A-level grades, your UCAS points for going into a pharmacy degree. And as Lynn said, probably the most important A-level is chemistry. Biology and maths are kind of the next two that kind of sit with it to do a pharmacy degree. But I think that as long as you've got those A-level grades there, or for example, a BTEC plus chemistry, that's what you're looking at. In terms of your GCSE grades, that's probably of secondary importance, I would say. Lynn, do you want to add?
Yeah, I mean, I showed you our grade profile. All the schools of pharmacy are slightly different, and I would encourage you to look across the range of universities that offer pharmacy and see what offers they have. There are a number that are very similar to us, and there are a number with slightly lower entry grades as well. So I think I'd encourage you to look right across the range of schools. Some universities will have a minimum requirement for a GCSE grade in English and maths. So you should also look at those. That might be a university level requirement, not for the pharmacy course per se, but it might be for, if you want to go to, I don't know off the top of my head, but I know that some of them require maths. If you don't have maths at A level, you need to have it at a 6. But I don't know off the top of my head. So I would encourage you just to look at them and browse the UCAS website and have a look through them all. The other thing, just on the UCAS website, you'll find that pharmacy is sort of linked with pharmacology. And some courses on toxicology and some other subjects which don't enable you to become a pharmacist. So just a note of warning on the difference between pharmacy and pharmacology. I probably should have said that at the beginning. Pharmacy is the MPharm program, the master's level program that takes you on a route to become a registered pharmacist. And it's the only way you can practice as a pharmacist in the UK. Pharmacology is more of a research-based course. Could lead to a more research-based profession. You can't do pharmacology and then become a pharmacist. And the course is different. It looks at the action of drugs in the body. It has more practical classes. It will be probably similar if you're looking at courses related to biology and biochemistry from a similar background perspective in terms of learning. And we have a pharmacology program as well. We have about 120 places on our pharmacy program. We have about 40 places on our pharmacology program, and many of those students go on to do further research or to work in industry. So it's quite different. Okay, and that's important.
Great, thank you so much. And then I do see we have a few questions asked that haven't been asked, that haven't been answered already, but I just want to touch on one more before we move on to them. Nick, I know you kind of covered the range of salaries for pharmacists and pharmacy technicians. Is that going to change at all with pharmacists being able to prescribe as the role is kind of changing?
No, I don't think it necessarily will. I mean, this is about a sea change in what the profession is able to do, which is a really positive thing. What we are seeing is, and pharmacists sit as part of, if they're working in the NHS, the standard NHS pay scales. I think that the ability to be a prescriber means that there is going to be more rewarding and interesting opportunities within the profession. And potentially it would also give the opportunity for new and different senior roles to be created, so that you might be able to progress into a senior clinician role, such as a consultant pharmacist role, more easily, because prescribing is part of your general skill set. But it doesn't mean that everyone is automatically going to get a pay rise and get paid more because they are a prescriber. Interestingly, in community pharmacy, typically the contract for community pharmacies has generally and historically been, how many medicines have you dispensed? So if you receive a prescription and you dispensed it, the remuneration for the company is on that basis. But there's an increasing movement towards payment for community pharmacy to be based on clinical interventions that they're making. So, for example, receiving a referral from NHS 111 or general practice, seeing that patient, reviewing the patient, and making a decision about their care and being remunerated as an organisation for that. So in that sense, community pharmacy is changing the way that it's being paid, or rather the NHS is changing the way that it's paying community pharmacy and what it's paying it for. And I think that's a really positive thing. because it's essentially rewarding and recognizing the clinical expertise of the pharmacy team within community pharmacy, rather than saying you get paid based on how many prescriptions you can churn through. So that's a very positive thing for the profession.
Great, thank you so much. So this question, I believe, would be best answered by Lynn, but I'd also love to hear Charlotte and Rhiannon, if you have anything that maybe you did. What is the best thing to include in your personal statement to stand out? So Rhiannon, if you maybe want to say if you did anything, then Charlotte, and then Lynn, if you have any more advice on this, that would be great.
Gosh, I'm trying to think back now to when I wrote it. I think it's important to show that you've got a passion for pharmacy, or your interest in pharmacy. Extracurricular activities are really good, because it's not just about showing. Again, it wouldn't just be about showing this is you want to do pharmacy. It's about putting yourself out there as an individual. What attributes make yourself stand out? What have you done that you believe makes you a really good candidate, and things like that. So I think it's just being sort of honest and using, I don't know, I'd say that just making putting yourself forward. Extracurricular activity is always really good, and sort of maybe show that you've looked into the profession, and that you've got a little bit of background knowledge. That's sort of the things I think, at least, that I focused on when I tried to do mine.
Great. Yeah. So just kind of letting your passion shine through in the application.
Yeah.
Great.
Yeah, definitely. Yeah.
Thanks. And Charlotte, how about you?
Yeah, I was trying to remember mine too. It wasn't even as long ago, but I think it was just being able to show that you're more than just your grades on a piece of paper, like what there is to you as an individual, and how you can link that to going into pharmacy and into that type of area. So yeah, basically what Rhiannon covered, really.
Great, perfect, thanks. And then Lynn, do you kind of have any concrete advice on this?
So yeah, no, I agree with what they've both said. I think we would like, what I don't want to read are 100 statements that all look the same. So I want to get a feel for you, absolutely, about you. We do want to know that you've thought about it, that this isn't just every time you write a sentence, then I think you need to look at it and say, could anyone have written that? I've always been interested in in helping people, and I like science. Could anyone have written that? So I think it's more about what skills and attributes do you have, where you've put yourself out and tried to get a bit of experience. Even telling me you've come to something like this makes me think, brilliant, that's engagement. I'm also interested in your wider skill set. We love things like Duke of Edinburgh, or those sorts of things which demonstrate that you've gone out and done other activities. You've got some breadth. I think it's I really want you to stand out. What makes you stand out?
Great, thanks so much, Lynn. And you guys, I know I said in the beginning, but way to go for staying until the end. You're all going to get a pathway badge from this, and it'll show you attended an event with the NHS about pharmacy. So you can put things like that on your personal statement. And this has been an hour long of your time in the evening. This is the kind of thing that makes you stand out when you're applying for things like this. So great to see all of you staying on. We do have about 2 minutes left. So if you haven't heard your question answered out loud, make sure you check in the Q&A box. A lot of the questions have been typed out. So make sure you look there to see if your question has been answered. And panelists, if you guys wouldn't mind just staying on and helping to type out some of the rest of these questions to make sure they all get answered. Great, perfect. So just want to move on now to the final page so that you guys can see these links. And Nick, if you kind of want to walk through them.
Yeah, absolutely. Am I? Yeah, I'm on. Good. So there's a bunch of different links here. So just to kind of explore some of these. So we've got the Health Careers website with exploring roles in pharmacy at the top. The careersinpharmacy.uk is the one which I put in the link. That's the careers map. Really, really good interactive resource. And the one below that is a link to an interactive PDF which guides you through kind of similar types of information about different sectors, different jobs, those sorts of things. There's a video that you can have a look at underneath that, and then the next 4 links underneath that. The first one there is the RPharmS, that's the Royal Pharmaceutical Society. So that's the professional body for pharmacists, which kind of represents us. It has a royal charter. You can become a member of the Royal Pharmaceutical Society. I'm a member of the Royal Pharmaceutical Society, and they've got information there on careers. The next one down is pharmacyregulation.org. That's the regulator, that's the General Pharmaceutical Council. So that's the organisation that you have to be registered with, and if you do anything terribly bad or naughty, they strike you off, the same way that, you know, doctors or any other healthcare professionals get struck off if they do bad things. So they've also got information about careers, and particularly around the list of accredited providers of the pharmacy degrees. So that might be quite useful. If you want to click on that link, it will give you the list of all of the universities in the UK that run a pharmacy degree that's accredited by them that leads to you becoming a pharmacist. And the bottom 2 links are the National Careers Service website. The first one is for pharmacist as a role, and the next one is that next one after that is pharmacy technician as a role. So a variety of different links there. As I said, if you want to look at one thing around pharmacy careers, go to the careers map, because it's really good, really interactive, and really visually kind of easy to engage with.
Great, thanks so much. And you guys, I will be sending you all an email with your badge attached, and I'll make sure to include these links in that email so that you have them accessible. So thank you all so much for being here and staying on. Thank you for your amazing questions. There's been fantastic interaction tonight. And thank you to everyone from the NHS and from Bath University for being on tonight. Really great information, and we really appreciate your time. So just in the chat box, I'm throwing a link in there to please fill out this survey. It'll just help us in the future make these events more catered to exactly what you guys want to hear. So if you could go ahead and fill that out. I will be in touch within the next week with your badge and these links. So thanks again, everyone, for being here, and thanks again, NHS and Bath.
Thanks very much, Rosie, and thanks very much to everyone who's come along to attend the session.
And if you haven't had your question answered yet, most of them are all set in the chat box. I think there's one more being answered, so make sure you check that for any answers.